Hello and welcome to WTNB Today. I'm your host, Wendy Benton. Thank you for joining me. I'm here today with Tracy Shellhouse, the CEO of New Hope Pregnancy Care Center, and Alondra Cooley, who is the new RN and nurse manager. I was going to say nursing manager, but nurse manager. Welcome to both of you to the show.
Thank you for having us.
Thank you for being with me. We're excited, as always, to hear about New Hope and the new things that are going on. And Tracy, you guys have moved, and
Yes.
you were here on the show before talking about the new facilities and the run. And tell us a little bit now, your next step.
Okay. Well, the reason we made the move was because we were planning to convert to a medical clinic, and we knew that our programs would grow as the medical clinic was introduced. And so we announced in 2013 that this was our plan, and we told people that we would do it by July 2016. We're actually ahead of schedule. We will definitely convert to a medical clinic, I believe probably spring of 2016. The reason we're doing this is because we have those in our community that need some more resources, that need extra help. And with us converting to a medical clinic, what it will enable us to do is offer nurse-tested pregnancy testing, nurse counseling about healthy pregnancy and things such as that. But one of the most important things is we'll be able to offer free ultrasounds for those that are coming through our doors. And this will enable them to know whether their pregnancy is viable or not. It is not only a resource, but it's an education resource for them to be able to see their child in their womb. And we know that it's going to enable us to have a greater footprint and impact here in Cleveland.
And a key component to that was bringing Alondra on
Absolutely.
board. You've
Yes.
got your medical director, Dr. David Chaffin.
Yes.
And now Alondra is going to be there full time, and that's exciting news.
It is exciting.
Alondra, tell us a little bit about you before we get into your responsibilities.
Well, I was born in Mexico. Came here to the United States very young. So I've been here in Cleveland for about 12 years now. I graduated nursing school from Southern Adventist University in Collegedale. I've been working at Tenova in the Women and Children's Services here in Cleveland for about 8 years now. And so when the nursing position at New Hope came around, it just drew me in. It felt like home. I have been volunteering at New Hope Pregnancy Center since 2009, so it was just very natural, I guess.
Yes, that's a good fit. You've already been there, you've got the skills, and then that opportunity opened up. Well, tell us what you're going to be doing there.
Well, I would like to reach out to our local OBGYNs just to get their backup, just so they know that we're available. And I will be doing the initial pregnancy test, and we will do the initial ultrasounds too. And then from there, we will refer them to their OB doctors to get, their prenatal care that they need.
Okay. And Tracy, what's going to make this program different? I know you've wanted to add the medical side to it to offer those services. Why would you do that, and then what makes it different from others?
Well, for one thing, there is no one else in this community or in this area that is offering what we will be offering, which is the free pregnancy test at a medical clinic and the ultrasounds. This will enable people to more quickly be able to get a confirmation of pregnancy, which will help them be able to get Medicaid if they need to, or even to be able to get in with their OBGYN because they will already have a proof of pregnancy. And it's a lot easier to set an appointment when you say, I've already been to a clinic. My expected date of confinement is, and it's easier to get work done. No one else is doing what we're doing as far as being a pregnancy help center here within this community and offering free and confidential services. What it's going to do on the whole, though, is it's going to impact our other programs. And one of the most important things we do is education for parenting. It is equipping either those that have never been parents before to be first-time parents, or even undergirding those that are already parents so that they can be more effective. And with people coming through for the free nurse-tested confirmation of pregnancy, and then getting the ultrasound, because it's a new service, it's going to draw more clients to us than who we're able to reach at this time. And as we do that, more of them will get involved in our programs. So we'll have a better opportunity to build strong families here in Cleveland and Bradley County.
Now, do you have to turn people away currently? I mean, do you ever have those that show up thinking maybe you're a medical facility?
At times, yes. And what we will do is we will go ahead and meet with them. We will find out what resources and referrals we can offer them that would help them in their situation. And then we refer them on to someone that can meet their need. We do have those that are coming through, you know, either interested in an ultrasound or maybe they need proof of pregnancy. And we can offer proof of pregnancy now. It is just dependent on the organization as to whether they will accept it because we're not a medical clinic. Our pregnancy tests are professional quality, and they are more than 99% effective, and we can give a proof of pregnancy. But what we have found in the past is some social workers recognize and understand the quality of what we provide at New Hope and have been providing for years, and they accept it. Others look, and simply because there is not the signature of an RN behind the name of whoever was able to witness that test, is not considered to be acceptable.
Okay. And then Alondra also will provide additional resources to Hispanic speaking people that come in. So I know that, and I guess you've already been doing that as a translator.
Yeah.
But having that one-on-one with all of those clients that need you is a very valuable resource. Do you see an increase in the Hispanic clients that you see?
Absolutely, yeah.
Yes. In 2014, toward the end of it, I hired a staff member who was bilingual, and she was trained to be a crisis pregnancy coach. And once our community found out that we were able to offer our Earn While You Learn program, our pregnancy test, follow-up and referrals by someone that is able to sit and speak with them in their native language, we saw an increase. As a matter of fact, within about 6 months, we saw our Spanish-speaking clientele increase about 300%. And I have not looked at where we are at this time of the year compared to last year, but it's most likely even higher than that. And so we've already seen an increase, but I believe we'll continue to see it. One of the things that is wonderful about our Spanish community is they're very close-knit, and they talk to each other, and they do a wonderful job of letting others know when there's good resources and help out there for them.
Right. Now, what about communicating this new program? How are you going to reach out to the community to let them know that you offer this, even to the Hispanic community, which a lot of that I'm sure is word of mouth, but do you expect to sort of advertise this?
Yes, and this today is part of that, is getting the word out and letting people know. We do have a big push that we're going to have to do, because when we do the in-house ultrasound training, we'll be bringing a group in out of Las Vegas, and they're called Sonography Now. In order to do that training, we need pregnancy models, and we'll need about 82 scans in a matter of 2 weeks. And 82 scans, that's a lot of pregnant women. And so we're actually already beginning to let people know that if you're pregnant, you can get in touch with New Hope, give us your name and number. Once we know the exact dates of training, we will follow up. And the women who are pregnant in our community that want to volunteer by letting us do a scan on them can receive a free ultrasound. And it's beneficial for us, it'll be a lot of fun for them. And long term, it'll be very beneficial for our community. Part of the way we're getting the word out is, as Alondra said, she will be talking to local OBGYNs. I know that she and our development director, Delaney Walker, have already started talking with our local, the Bradley County Health Department, and are planning on doing some follow-up conversations. We'll be putting it on Facebook, social media. We will continue to do interviews and probably even have posters up all over town by the time we're done with it.
Okay, well, I'm sure you will get those ladies in the office for a free ultrasound, and it's always exciting to get those ultrasounds, to see your baby, and I think that's going to be an easy task to do. Have you had any opposition just opening a medical clinic, just from any of the other entities in town or outside, that you're a pregnancy care center? have you seen any of that?
Actually, we have just received much support and a lot of encouragement. I think, you know, some of the OB-GYNs that we work with now that we refer our clients to are very excited that we'll be able to offer these services. I think when we first announced it, it wasn't as much opposition, but maybe some confusion and people trying to understand exactly what is New Hope wanting to do. Because this is new. This is something different than anything we've ever done in the past. And it is a big endeavor to add a medical program and convert to a medical clinic. The liability, the responsibility, there is a lot more required of New Hope in order to be able to do this. Not only the initial onset of the program, but then the longevity, even funding the program. Our initial cost to get it started is about $160,000. And then the ongoing year after will run us anywhere between, you know, and let's just look at 10 years down the road, anywhere between $60,000 and $80,000 a year on top of what our current budget already was. And so we had some people that, not as much opposition, but they were wanting to know, is it really necessary? But it is, and as we've explained, what it will enable us to do, for one thing, we know that 80 to 90% of abortion-minded women who have the opportunity to see their child via ultrasound will choose life. Because when they see that, it's no longer a picture of someone else's baby. Many have heard you know, people say it's just a blob of tissue or products of conception. When they have the opportunity to see their baby moving, kicking, waving, its heart beating, all of a sudden it's not just a baby, it's not a pregnancy, it becomes my baby. And so we know how powerful that is in and of itself. But also to be able to offer services like early ultrasounds for women who maybe would not be able to get one yet with their OB-GYN or with their medical practitioner. To be able to do that, we know that 1 out of 4 pregnancies naturally terminate in the first trimester. So we will also have the opportunity to diagnose miscarriage and to be able to get that important information back to those women so they can seek care, because miscarriage can be very detrimental to a woman's health, and there are at times it can even bring death. And so by them knowing ahead of time, they have the opportunity to go ahead and preemptively reach out and know that this is something that they need to seek care for.
Well, it's exciting news, and I'm glad that you're bringing it to our community, that our families and women have the opportunity to come and to a quality facility that will provide those medical services that they need. And as you mentioned, you know, that maybe abortion-minded, that they will recognize that there is life there, and that they would choose life and keep that life, or bless someone, you know, with
yes,
who's
adoption
interested
is a wonderful
in adoption.
option.
Yes, yes,
yes.
Well, it's so good to have you both on the show, and we will be talking again in the coming months, because you want to make sure we get the word out for those ladies who are expecting, who would like to have a free ultrasound, just to help in the training process of the program. And I know that's going to be a fun and exciting time. So we'll be talking again in the next month or two as well.
Yes.
Thank you both for being here. Alondra, you did a great job. Thank you. And we're excited that you're on board with Miss Tracy and the staff here at New Hope.
We're very excited too.
Thank you for joining us today, and we will see you next time on WTNB Today.